Hello, everyone. Welcome to Author Spotlight for the month of March. I'm Patty Pellikka, Editor-in-Chief of Journal of the American Society of Echocardiography. It's my pleasure to be joined today by Dr. Monica Mukherjee, who is Associate Professor of Medicine and Medical Director of Johns Hopkins Bayfield Medical Center Echocardiography Laboratory in Baltimore. Welcome, Monica.
Hi, thanks so much for having me.
So Monica is the chair of the writing group that produced the new guidelines on the right heart, the echo assessment of the right heart in adults and special considerations in pulmonary hypertension. Tell us about what our readers might find in this new updated guidelines document.
So we are so excited. This was really a huge effort that brought together new collaborations that we haven't done so far in the field of echo, where we put a lot of thought and intention into the writing group. And so we included pulmonary hypertension specialists. So, we've never really had a pulmonary hypertension person be part of the guidelines. And we did that in an effort to really focus on the pivotal advancements in echo assessment in this screening, early detection, and then monitoring of prognosis and therapeutic management of patients with pulmonary vascular disease. And so we were very excited about how this guideline turned out, that we really considered the physiologic aspects of the underlying disease as well.
It's an amazing document, and there's been so much that has changed since the previous version published in 2010. I remember when that document came out, just the focus on being quantitative in our assessment of right ventricular size and function was just novel and important. And now we're considering more of the impact of pulmonary hypertension and how to assess that, and also the right atrium. What other changes have occurred?
So, I think since the first guidelines came out, that was really the first focus that we as an echo community placed on how integral the right heart is into the overall performance of cardiac function across many disease states. And what happened in the interim is that the World Symposium of Pulmonary Hypertension actually realized that patients who had a mean pulmonary arterial pressure by right heart cath between 21 and 24 were at an increased risk of developing overt PH within 5 years. And so they lowered that threshold, but no one really realized what that effect that would have on us as an echo community. And so what this has brought to light is that echo really is at the forefront of screening at-risk populations. And how do we screen for this disease? And how do we use different metrics, not in isolation, but in an integrated framework to help refine who is going for right heart cath? And can we also use echo to help with even phenotyping across the different classifications?
I know you're an expert on this subject, but as you reviewed the evidence to prepare the guidelines, did you come across anything that just really surprised you?
I was really surprised at how much we have advanced in terms of tricuspid valve disease, and also how much remodeling of the right heart can be detected by echo. So we always kind of think of echo on the extremes of when patient is in overt right heart failure. But there are a lot of changes, subtle changes that we can see early in the disease course that may help guide, hey, this patient is at very high risk and we should jump on them. And that really wasn't a focus before. So really, again, I think it's reiterating that echo is that first step and is the mainstay in screening and early detection of these patients.
What should be the focus of research over the next several years?
I really think that using an integrated approach across many variables is going to be an important part of the clinical framework. And how do we do this in, incorporating AI and different new technologies of, if you have kind of a hierarchical approach of which variable is the most important, what combinations of variables are the most important, are there disease-specific combinations? the trajectory of those combinations. And I really think that there is an emerging role for AI to help guide some of those decision branch making points for us.
Thank you for visiting with me, Dr. Mukherjee. And I'd like to call the reader's attention to the issue. The entire issue is focused on echocardiographic assessment of the right heart. So with the guidelines underpinning it, I think you'll enjoy the issue. Thank you.
Thank you so much.